Nacho's crew. This is Paul, Dr. Nacho, here bringing you resources to help you get through this challenging time. When we get reopened, one of the key things that we're going to need to do is be flexible with our financing, which is why I'm so glad to have our key resource and sponsor, CareCredit and Samir, here with me today. Samir, introduce yourself to our audience, what you guys do and how you help dentists.
Absolutely. Well, thank you for having me. My name is Samir Basin. I'm the VP of Alliances for CareCredit. And historically, what CareCredit has done is helped our doctors be able to offer the dentistry they want to the patients to accept, and patients to have the choice to be able to accept it. So we make it easy. We make it easy for them to accept that care, because nobody wakes up in the morning thinking I'm going to spend X amount of dollars for anything, let alone, and I love our profession of dentistry. So making it easy, taking the friction away, and making it easy for the patients to say yes to the recommendations.
And what I see now is, and I've been a dentist for 17 years, we're going back to a new dental world. I've watched a lot of princess movies in my house. We've watched some of them like 40 times. So a whole new world, and we need to be flexible ourselves. So for us to be able to have a resource where patients don't have to necessarily use check, cash, credit card, and they can use financing, CareCredit can help. We will have plans, and you're exactly right. A patient may be coming in thinking, oh, I broke a tooth, and next thing you know, they have a $10,000 or $20,000 treatment plan that they're going to benefit from, and adding in a flexible financing option is so important. So just walk me through, Samir. Let's say I've never used a financing company, I've never used CareCredit, but I want to learn about this now so I can hit the ground running. How would I do that with you guys? And a little bit of the conversation you'd have if I'm a patient who needs a $7,000 worth of treatment.
Yeah. So I mean, especially if you don't have it, of course, the best way is for you to get enrolled first. But let's just assume that you already have it. You just have not taken advantage of it as you could have in the past. So we'll use that as a scenario. So of course, some of the places that you can do is, of course, our reps. You can still get on call, and we can help you do the training and do online training, et cetera. And this would be the best time to figure out what is your financial policy going to be. What are those patients, to Paul, your point, when people come out of this, they are going to want to hold on tight to their cash and their credit cards, and especially their life expenses that they put on hold. So
times, like you're saying, it could be me. If I had a $12,000 treatment, if I had a $12,000 expense in my Dr. Nacho life, where previously maybe I'd want to take care of it and even get a payment in full courtesy, I might say, you know what, I want to stretch it out over 12 months. I want to make sure that my own finances are right. So I just think this mindset shift is going to happen. So first you get enrolled with CareCredit, you learn how to use it, and then who can train your team how to start to have these conversations with your patients, as well as how CareCredit works?
Yeah, so in very simplistically, I can say the way CareCredit works is, as a provider, as a doctor, your team will offer it to the patient. The patient will possibly apply if they don't already have a CareCredit card with them. So we'll use that example as first. If they don't, they apply. It should not take more than a few seconds. At the worst case, about a minute. We make things very easy. If they're approved, and when they're approved, they will get the account number and the credit line immediately. So now you at least know what you're working with. And you can.
What I don't want to cut you off, sir, but I want to. JFO, just find out. Your patients can just find out about this. Seems like a very relatively, use a dental term, painless process to find out if they're going to be approved.
Yes, and if they're going, and there is that portion of it, like we call it the quick screen side of it, where just to kind of get an idea if they will get approved or not. But of course, the best way is always to do that application. The moment they do it, now the conversation opens up to what promotions can you offer to make it more attractive? Because keep in mind, I'm just going to use a dollar example as an example, like $1,200. If you say 6 months, to a lot of patients, it may not be the most comfortable way of being able to pay. So now they'll say, well, how much would insurance cover? Let's only do smaller amount. Or you can say 12 months or 18 months. Now I'm looking at $100 or less than $100 a month. Makes it attractive. I say yes to the treatment that's been recommended. So that's the easiest way for the patients to say yes. Because it's not, I always say, we don't buy houses, we buy mortgage payments. We don't buy cars, we buy car payments. It's the same analogy. Once you present it to them, you will find how patients, you want the patients to be engaged and keep the conversation open instead of, okay, let me think about it.
Totally. That's my favorite thing. Momentum, Samir. Momentum is one of my favorite words. So if a dentist in their office are watching this, listeners, how can they reach out to you guys to learn more and get signed up and start this process?
Well, I mean, it's the easiest would be for them to call their provider services number. It's 800-859-9975, and we can connect them to their local rep. There's actually a rep that is assigned to them who right now, even though because of social distancing, you can connect with them. They can do a Zoom call similar to like this. I mean, virtual world is where we live right now. They'd be happy to do that with you, with your team, whoever you wanted to. So that's one way to connect. And of course, once things open up, they'll be happy to do that face-to-face.
I mean, dentists, do this while you have the downtime. Use your dentisting downtime for this. You also can visit carecredit.com, but reach out to your local rep. Samir, thanks for sharing with us. Really great tools and strategy for us to reopen and be successful. It's one thing to reopen your business, dental practice. The other thing is to be successful. And I've known in being a dentist for 17 years, people don't love to spend money on dental care, but they need it. They'll benefit from it, and CareCredit will help. Thanks so much, Samir.
Absolutely. Thank you.